Okay, you are about to participate in a medical assessment. And as you do this medical assessment, I want you to use the National Registry Skill Sheets for medical as the foundation of how you perform this assessment. If you do something a little bit out of order, I'm okay with that. As long as you provide a good assessment, you provide the correct treatment, and you ask the right questions along throughout the assessment. So this scenario is one where you are on an ambulance, you are with another EMT provider, and a QRU with three other EMTs respond. So a fire engine and an ambulance, you're all EMTs. If you want extra personnel, you're gonna have to request it. So you're dispatched to a 54-year-old male who has an altered level of consciousness. This patient's wife calls 911. It's 1 o'clock in the morning. She says her husband is not acting correctly and she wants an ambulance to come check him out.
Okay. Okay, I'm going to start with my PPE, making sure I have my gloves, my glasses, everything on. Then I need to determine if my scene is safe. BSI, is my scene safe?
It is safe.
Okay. Next, I need to determine the nature of the illness or the mechanism of injury. So if I talk directly to the patient, asking him what's going on, is his level of conscious high enough to answer my questions?
Um, I will tell you, you arrive on scene. The wife meets you at the front door, waves you in, and she says, "My husband's just acting weird. He's not answering my questions. He's just kind of mumbling. He's super sweaty too. And I thought he wet the bed, but he didn't. I've never seen him like this, and so I don't know what to do."
Okay, so I'll just ask one clarifying question. It's just your husband that's feeling that way. She's not feeling this way at all. No injuries, no illnesses in her half.
Yep, nope. It's just the two of them in the house, and it's just him acting funny.
Okay, so I've determined I have one patient. At this time, I will consider stabilization as he's fine if I see the patient, but if he's mobile and moving around, he's not complaining of any injuries, pains, or anything like that. He hasn't taken a fall that we know of.
Yep.
So my initial impression of the patient is sick. Something's wrong. So I'm going to dive into that a little deeper. So now I want to talk to him to discover his level of consciousness. Sir, how you doing today? What's going on?
So you walk in the bedroom. He's sitting on the edge of the bed, kind of frumpy, and he's awake. He looks at you and he says, I don't know."
Okay, so he's awake and he's verbal, mumbling verbal. So are his eyes open to me? Is he able to look at me, or is he looking
Yep.
around?
Yep. The
Okay.
lights are on, but nobody's home type of look.
Okay, perfect. So I'd like to get a blood sugar.
Okay. All right. So blood sugar comes back at 35.
35. So he's definitely got a low blood sugar. So see, I can let's get some treatment started for that and see if that helps. We've determined his chief complaint. Um, he's just not quite there. Wife says he's not feeling very good. Um, how's his airway? He's breathing okay? Does it seem like his breathing's labored?
You look at his airway. His airway looks good. You see a little bit of drool coming down the side of his lips, and his breathing is adequate at 14 breaths per minute, non-labored.
Non-labored, he's breathing all right, he's talking, he's awake, he's all right. So we got a blood sugar back at 35. Let's ask some questions here. Is he diabetic? Does he have a history of diabetes?
He is a diabetic.
He is a diabetic. Okay, are there any other medical illnesses, conditions that this gentleman has, our patient has?
He has high blood pressure and he has hyperthyroidism.
Okay. Hypothyroidism and high blood pressure. Does he take any medications for any of those?
He does. She knows he takes lisinopril, but she's not sure of the other medication names.
Okay. And we noticed that he's sweating a lot. He's very diaphoretic. Uh, is he losing color? What color is his skin?
Yeah, his color is pink, warm, and very diaphoretic.
Okay. Does he have any other, is he feeling any chest pain? Does he have any, how's his pulse?
He denies chest pain. He's got a good regular pulse at 72.
Okay. Okay. So we're going to move forward with just that. So we're going to identify that this patient needs, he has a low blood sugar. He is a diabetic. When was his last oral intake?
She said that they ate some chicken and mashed potatoes last night for dinner, and that they were going to have a dessert, but they didn't have any. They thought they had some ice cream, but they looked in the freezer and there wasn't any. That was about 7 o'clock.
Okay. So let's get some, see if the wife can maybe get us some orange juice from the fridge, maybe make us a peanut butter sandwich, and then we'll get some glucose on board, oral glucose.
Okay.
And then we'll see if we can get his sugar up. We'll check that again in 5, 10 minutes.
Okay. Excellent. I will tell you in that 10-minute time frame that he drinks a glass of orange juice. You get a tube of oral glucose in his mouth, and he eats about half of a sandwich.
Okay, perfect. And then while we're waiting there, then was he doing anything? What was he doing at the time when he started feeling funny? Has he been feeling off all day?
Nope, they went to bed about 10 o'clock, and it's now 1 a.m. and he's super diaphoretic. He didn't say anything. He was
Okay, good.
normal when he went to bed.
While he was sleeping, he's already denied any pain. So we have no reason to ask about quality or severity. Nothing's radiating. So let's recheck sugar.
Okay. Recheck the blood glucose, and it is now 47.
47. Okay. I'd like to request additional units. Let's get some ALS out here. They'll have some medications they can give different routes than I can that might be able to help him to get up high enough to not have to go to the hospital if he's going to be combative about it.
Okay.
Um, and then we can re-administer another tube of glucose.
Okay. All right. So give him some glucose. You've already started giving him food, so I would tell you that he has another glass of orange juice and finishes his peanut butter and jelly sandwich.
Perfect. We've already discussed medications, events leading to this. They were sleeping. He's not complaining of any other pain. Let's get a blood pressure and recheck his pulse again and just see how his vital signs are trending in general.
Okay. So his blood pressure is 146 over 98. His
Okay.
pulse is 76. His respiratory rate is 16. And O2 saturation is 97% on room air. Are there any other
Okay.
vital signs you want?
Let's recheck his sugar again.
Ooh,
Now
love
that
it.
we've had some more glucose on and he's eating some more.
Okay, so his blood sugar is now 61
61.
after 30 minutes of being there.
Okay. How's he feeling? Is he talking to us more? Is he more awake, more verbal?
Yes, so he's slowly eating better, and he's slowly talking to you a little bit more. He is certainly waking up.
Perfect. Okay. Um, and our ALS units, have they arrived yet? Are they responding? Or I
Nope,
guess we
they're
could
still
talk.
about 6 minutes out.
Okay, so then we'll talk with the patient about options moving forward. If he would like to go to the hospital, we can't kidnap him, of course. His sugars are rebounding. Ask him if this is a normal thing for him. If he regularly gets low.
Okay. So he says, "No, I don't want to go to the hospital. I think last night I after dinner I took my insulin and I accounted for that ice cream we were going to have, and then we didn't have any. And so I think I just gave myself too much insulin. I bet you that's what happened. It's happened one other time, and that's it. But no, I don't want to go to the hospital."
Okay. and we can't force him to go. So I would have one of my partners prepare a refusal form so that we're covered there. And then I would stay with him until we can get his sugar up to probably around 75 to 80,
Mhm.
depending on what his baseline is. I guess we could speak with him about that. How long has he been diabetic, and where does he normally sit operationally?
It bounces all over the place, but he's usually able to control it pretty good and that around 100.
Okay, perfect. Yeah, so we would definitely stay on scene until he's somewhere around 75, 80 and able
Okay.
to answer our questions, make
Okay.
sure he's AO times 4, and then get our refusal signed. We could probably stand down ALS at this point.
Okay.
We're not going to need their interventions.
All right. I'll tell you that his blood sugar is now 88. He again refuses transport. And so he signs a refusal and you're done. However, I would like you to give me a patient care report as if I'm the medic there to help you out. So what do you got?
Absolutely. So we have a 54-year-old male here. We came out for altered level of consciousness, altered level of awareness. Wife said he wasn't acting right, was worried about him. We arrived on scene. He was very diaphoretic. Uh, not He was awake and verbal, but not there completely. He was able to talk, but it was pretty mushy. We took some initial vital signs, and his pulse was good, his blood pressure was good, but his sugars were down. He was about 35. We went ahead and gave him some oral glucose and some orange juice and a peanut butter sandwich on board, and waited for that to kind of kick in to recheck sugars. In the meantime, we spoke with the wife, found out that he is diabetic. He does have high blood pressure. He's got a list of medications, and we have that written down here on our chart for you. He does not want to transport at this time. We have been able to get his sugars up. We dosed again. We gave more oral glucose, and he finished his sandwich, had another glass of orange juice. We got him up to about 88. His respirations are good. His pulse rate's good. Blood pressure's great. And he is refusing transport today.
Terrific job. Great job. Um, let me go back through it and see if I can beat you up on anything. So no, I think you did a terrific job. I don't know that you got his allergies. It's good patient history taking, but it's not pertinent to this particular call. But you will have to document that in your overall documentation. If there's one thing I could express to you is that check that orientation early and often. You tried getting it early on. He's like, well, I'm not going to talk to you because I don't understand what you're saying. And then trend that orientation as you go. So for someone like this, they're going to give you the shoulder shrug and the I don't know answers, or the totally wrong answers as that blood sugar goes up. Say, hey Frank, how you doing? Wake up for me. Yeah, okay. Where you at? I'm at home. Okay, what's your address? I don't know. Okay. Well, at least you know you're at home. We're trending in the right direction. And then finalize it. Hey, Frank, you know where you're at? Yeah, I'm at home. Where are you at? 1826 Forest Grove Lane. Okay, good. That's it. Date, month, president, how many quarters in a dollar, whatever questions are going to help you out there. So, but yeah, I think you did a great job. A little bit out of order on the skill sheet, but you came back and answered the appropriate questions. So good job.